Hello, this is Dr. Grant Cooper from Princeton Spine and Joint Center. In today's video, I would like to discuss plantar fasciitis. Specifically, what is it, how do you get it, how do you prevent it, and importantly, how do you treat it so it goes away and stays gone? We're going to get into all of that in a moment, but first, I do need to pause for a moment to remind you to please remember to like this video by clicking on the thumbs up button and subscribe to our channel so that we can continue to grow and reach and hopefully help more people. Did you subscribe? Okay, thank you for your support. Now, on to plantar fasciitis. Plantar fasciitis is the most common cause of heel pain. The plantar fascia is a thick band of connective tissue that runs along the bottom of the foot from the heel to the toes. Plantar fasciitis is inflammation of that plantar fascia. Plantar fasciitis typically presents with heel pain at the insertion of the plantar fascia in the heel. The pain is usually worse when you get up in the morning and when you first take those first few steps of the day. Then it tends to feel better as you keep moving around, only to feel worse again as the day wears on, or if you've been sitting for a while and then you go to stand up and take a few steps. During the day or at the end of the day, the pain from plantar fasciitis is usually worse after an activity as opposed to during that activity. The reason why plantar fasciitis is worse in the morning is that when you're sleeping, your foot plantar flexes. That is, it flops down. And that allows the plantar fascia to relax. All night, it's like this, it's relaxed. Then you wake up and you put your foot down and that stretches the fascia out that's already inflamed. And this stretch for the first time, it hurts a lot. The first few steps, the fascia continues to be stretched and it's very painful. Now, as you keep moving it, the plantar fascia loosens up and it stops hurting so much. But if you sit for a while during the day, the fascia rests again and then you go and put weight on it and start moving. And again, the fascia is being stretched and it hurts. Plantar fasciitis typically occurs because of mechanical reasons. Historically, it was thought that plantar fasciitis was caused by heel spurs, and so you saw a lot of surgeries for those spurs. But today we know that 1 in 10 people have heel spurs, but only 1 in 20 people with heel spurs develop plantar fasciitis. Further, some doctors actually feel that in some cases the spurs might be caused by the plantar fasciitis. Generally, what leads to plantar fasciitis is having flat feet, or ironically, the opposite of that, which is high arches, tight calf muscles, high-heeled shoes, shoes with poor support, abnormal gait, repetitive impact like with running, and spending lots of hours during the day on your feet, as well as being overweight are all risk factors. Diagnosing plantar fasciitis is basically a clinical diagnosis, meaning you don't need an imaging study or a blood test to make the diagnosis. The history is usually pretty classic. It includes pain in the heel that's worse when you first get out of bed in the morning and worse when you take those first few steps of the morning. The heel pain is usually worse after activities that involve repetitive walking or running or standing. And on physical examination, there's usually significant tenderness just in front of the heel bone, where the plantar fascia is attaching. The pain is typically made worse with dorsiflexion, so with bringing your toes up, which stretches the fascia, and then pressing on that plantar fascia, and it's usually made better with pointing your toes down into what we would call plantar flexion. Imaging tests like x-rays are sometimes obtained mostly to rule out other potential causes of heel pain. If the person has numbness or tingling or burning in the heel, then it's also important to rule out tarsal tunnel syndrome, which is an entrapment of the posterior tibial nerve, which can also cause heel pain. Okay. Non-surgical treatment for plantar fasciitis is generally very effective. This should generally involve first looking at the biomechanics that may have led to the fasciitis in the first place. So, for example, if you have flat feet, then using an arch support with or without a heel cushion in your shoe can be very helpful. If you don't have good supportive shoes, then changing to good supportive shoes would be very important. If you're a runner who runs on concrete, like the sidewalk, then changing the surface of your running to a more shock-absorbing surface, such as a track or grass or a dirt trail, would be helpful. Often the calves are found to be tight, in which case stretching the calf muscles is really important. Along those lines, one of the most immediate ways to reduce the pain of plantar fasciitis is when you first wake up in the morning, have a belt or a rope by your bed and then wrap it around your toes while you're still in bed and stretch your feet and your calves before you get out of bed. This stretches the plantar fascia before you go through the trauma of that first step of the day, and it loosens up the fascia so that when you take that first step, it doesn't hurt. It doesn't stretch like that, and it doesn't hurt. Ice and topical nonsteroidal anti-inflammatory medications, such as over-the-counter Voltaren gel or prescription Pensed, can be really helpful to reduce the inflammation. Physical therapy, in which the therapist can utilize their passive modalities, such as electrical stimulation, ultrasound, soft tissue mobilization, and massage, as well as they can instruct you in therapeutic exercises, can be really helpful. Some doctors and therapists advocate for shockwave therapy. The idea of shockwave therapy is to deliver shockwaves to the fascia, which then cause a microtrauma in order to trigger a healing response in the fascia. This is met with mixed reviews in the literature. I haven't seen it personally in my practice be particularly helpful, but it does have its advocates. Wearing night splints that keep your feet in dorsiflexion, bent backwards, can be very helpful. They basically keep the plantar fascia stretched all night. The main problem with night splints, at least from my clinical experience, is that patients tend to hate them because they're hard to sleep with, at least for a lot of people. Some people don't mind them at all. But in difficult to treat cases or in patients who don't mind them, night splints can be really helpful. In particularly difficult cases that aren't responding to more conservative care, a doctor can perform an ultrasound-guided plantar fascia steroid injection. This is a great way to deliver anti-inflammatory medication to the site of inflammation. If it's done, it should always be done under ultrasound guidance to ensure that it's as safe as possible and that it's optimally placed. But even when it's done perfectly, steroids around the fat pad of the heel can have the potential adverse effect of leading to fat pad necrosis, and it can also lead to plantar fascia rupture or tear. These are uncommon but very serious potential adverse effects if they do happen. So usually doing one steroid injection is not a particular problem for plantar fasciitis, but it can be, and repeated steroid injections need to be done with extreme caution because fat pad necrosis and plantar fascia rupture are real potential side effects, and they can lead to lifelong debility, so they need to be taken seriously. I've seen thousands of patients over the decades with plantar fasciitis, and I've never seen one or I don't even know of a colleague who's seen one who has needed to have surgery for plantar fasciitis. Most people with plantar fasciitis get better with some combination of orthotics, topical NSAIDs, ice, and stretching plus or minus structured physical therapy. Some cases that have been particularly difficult to treat required a combination of most of the conservative therapies put together, including altering the surface of running or changing shoes, including sometimes stopping wearing high heels, at least for a while, ladies or guys, not judging. Of all the conservative treatments, the ones that I get the most pushback on are the changing of shoes to be a more supportive shoe for the foot, and the night splints, which some people just won't tolerate. Usually, in my experience, if a patient's not getting better despite good, aggressive, conservative therapy with all of these things, including lots of stretching of the calf muscles, if it's still not getting better, then you may need to rethink your diagnosis. Maybe there's a nerve issue that's going on or something else entirely. With all that said, some patients do have surgery for plantar fasciitis, and that's generally going to be a gastrocnemius release or recession, in which the goal is to lengthen the gastroc tendon. There's also a surgical procedure called a plantar fascia release, in which the plantar fascia tissue is partially cut to relieve the tension in the tissue. That's it. I hope you've enjoyed this video. I hope you've learned something. If you have enjoyed it, please remember to like this video by clicking on the thumbs up, and please subscribe to our channel. If you have any questions or comments for me, you can reach me at Dr. Cooper at princetonsjc.com, or feel free to leave a question or a comment for me in the comments section. Thank you very much, and I will see you in the next video.